STD, STI, and HIV prevention. Welcome everyone. In today's session, we're going to talk about how you can protect yourself from sexual transmitted disease. STD is sexual transmitted infection. STI and HIV/AIDS prevention is the key. And we'll break down some simple but effective measures to reduce the risk. Let's start with understanding the basic STD, STI, and HIV.
Safe sexual practices. The first and most important measure in preventing STD, STI, and HIV is safe sex. This includes using condoms correctly, whether it's vaginal, anal, or oral. Condoms provide a physical barrier that helps prevent the transmission of HIV and other STIs. Be sure to use them correctly every time. Limiting sexual partners. Reducing the number of sexual partners lowers your exposure to potential infection. Engaging in a monogamous relationship with a partner who has been tested and is free of infection is one of the best ways to protect yourself. Pre-exposure prophylaxis. If you are if you are at high risk for HIV, taking PrEP daily can reduce the risk of HIV infection by over 90%. It's a highly effective way to prevent HIV transmission, especially if you are in an environment where you are exposed to a high risk of contracting it.
Next up, testing and communication. Get tested regularly. If you're sexually active, it's important to get tested for STDs and STIs and HIV regularly. Early detection is crucial for effective treatment and to prevent the spread of infection. Partner communication. Be open and honest with your sexual partners about your sexual health. Encourage them to get tested as well. Discuss the use of protection and the possibility of getting tested before starting sexual activity. Health communication can prevent a lot of risk.
There are also vaccines and lifestyle choices that can help reduce your risk of certain STDs. Vaccines like the hepatitis B vaccine and the HPV vaccine can protect you from the serious infections that are transmitted sexually. HPV, for example, is a leading cause of cervical cancer and genital warts. Avoid high-risk behaviors. Activities like sharing needles or engaging in sex under the influence of drugs or alcohol can lead to risky behaviors. If you are using intravenous drugs, do not share needles and avoid situations where your judgment may be impaired. Safe choices reduce the likelihood of exposure of infections.
Progression. The HIV is a virus that attacks the immune system, which are secret to immune defense of our body. If untreated, as the immune system, again HIV can progress to AIDS, leading it to severe infection and weight loss. However, with early diagnosis and consistent antiretroviral therapy, people with HIV can live long, healthy lives and prevent the progression to AIDS.